Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. It is my privilege to be here with Frank Westermann, co-CEO and co-founder at 9amHealth. Frank, great to see you.
Hey Logan, thank you so much for inviting me today.
It has been really cool to watch your journey. When we first talked, you explained to me about how you sold My Sugar, your previous company, to Roche, and then I think it was about 4 years before you jumped back into the fray with this company. So I want to know kind of what were the ingredients that you saw in the market where you said, you know what, it's time for me to get back in.
Yeah, so I think first of all, to better understand why I did it, I live with type 1 diabetes,
Okay.
so I have a deep kind of personal kind of commitment, to the space, and, amongst us,
Yeah.
that's the only thing I'm really good at, So, but I think it's important to kind of, I'm a patient, so I really understand kind of the patient journey, where are the friction points, if you live with a cardiometabolic condition like diabetes, or, you need to properly manage your weight. And, of course, over the last 4 years, a lot of interesting things happened. So you might remember COVID where I think we had a lot of regulatory changes, in the healthcare space, but also we as a society, all of a sudden, were much more receptive, to virtual care models.
Yeah.
So, and that was an important point. And kind of on top of that, certainly we learned a lot of things, when we were working at My Sugar. And one thing we clearly learned is, at My Sugar, we were more kind of relying on lifestyle intervention, helping people to better understand their data.
Okay.
And we saw that it worked well for like 5 to 10% of the people we were treating with over a longer period of time.
Okay.
But if you want to kind of have longer sustained great clinical outcomes, you clearly also need to have the opportunity to actively manage medications.
Okay.
And really build a more clinical care journey. And that's actually what we do at 9amHealth today.
Okay. So
Yeah.
break that down for me. It's more of the journey piece. In other words, like more touch points for the patient. Is that the idea?
That's the idea, but limit the friction points you have as a patient during that journey. For example, and then also a real focus on the clinical pieces, real care by endocrinologists, doctors. We prescribe medications, we do labs, so we send people
The
to
full
your
virtual
home.
clinic model.
It's a full virtual clinic model, exactly.
Okay.
Yeah.
What are some of the aspects of the program that you're like most excited to introduce to fellow individuals with diabetes?
Yeah, so I think most kind of thrilled we are like how seamless and enjoyable that whole care journey is. So
Okay.
because we manage everything through an app, most of the interaction are synchronously, so you can do it whenever you want on your schedule. You can book an appointment with a lab technician, for example, on your schedule.
Okay.
So you can even, if a member lives in a more rural area, we send out a device. You patch on your arm. We get a wet blood sample.
Okay.
That allows us to, get a lot of biomarkers. That you wouldn't get with, for example, a dry blood spot test. So. These are the things I'm really excited about, and most excited, quite honestly, I'm about our clinical outcomes because they're amazing.
Yeah.
So, and we lower A1C over 2% if
Okay.
you have an A1C of higher than 8%. We lower your blood pressure by around about 10%. So, and we have massive impact on your
Nice.
weight when
Nice.
you manage your weight as well.
Nice. It sounds like a very high-touch sort of experience. So talk to me about the business model, who pays, and kind of what your vision for that is.
Yeah, so we currently do most of our business with PBMs, with employers. We're very proud. We just launched our first health plan.
Okay.
So our first Medicare Advantage plan with Eternal Health.
Congrats.
We're live for a few weeks, or 1 week now. And we still do kind of a D2C approach. So
Okay.
because our vision is really, if you live with a cardiometabolic condition like diabetes or you hypertension, whatever, we want to have a solution for you totally independent of your insurance status. So even if you have no insurance, we want to be able to offer you a solution.
Yeah. Talk to me about the interplay between automation and the human touch, and just kind of how that's changing. I know it's so essential for you to be able to get that specialist, get that therapist, and yet you have to be able to scale the human touch through technology. So kind of what does that look like for 9am? And then also kind of where do you see that moving in the industry?
Yeah, so, as I'm a patient myself, I love a human interaction.
Yeah.
So I think we want to be treated by human. It's something, your health is something very, very personal. So I think it's always better to share it with a human. But of course, I think we have a lot of opportunities for automation, especially because so much, almost all of the care that we provide is done asynchronously. So we have a lot of chat interactions between a care team member and a patient. And yeah, I think that we will be able to, over time, leverage these interactions, that our language models will learn how to properly interact with patients. I don't think that we come in the foreseeable future anywhere close to automatic prescribing or whatsoever, but I think a lot of the more noisy conversations we can probably automate.
And what do you see as the general sort of appetite for innovation within type 1 diabetes right now?
I mean, there's always a huge appetite for innovation, so I'm still waiting for the day that I can get rid of my type 1 diabetes.
Yeah.
So
I guess I'm also pairing that with funding. Like the appetite has to be paired with the desire for people to pay for it.
yeah, I mean, I think maybe taking one step back, and if I think about, how I treated my diabetes 25 years ago versus today, it's day and night. I basically outsourced my care to an algorithm.
Yeah.
And that is, of course, very different than pricking your fingers like 10 times per day, injecting with a pen. So that's amazing. Nevertheless, fun fact, I recently was checking my own smartphone usage, and I saw that I spent 50 minutes, 50 per day just in my diabetes app to manage my own diabetes. So, and that is something that's also important, that's why I was talking about a frictionless care journey earlier on, because it shows how much impact it has on my day-to-day routines.
Yeah.
50, so close to an hour per day I spent with my personal care. So, and I think that's totally underestimated what an impact diabetes type 1 or type 2 has on your life, because that disease is has so much impact on your food choices, on your workout. How do you work out? Did you work out enough? So
What I hear you saying is that when you make that frictionless, you're actually giving people their life back. That's
totally
hours, days, years of life.
Exactly.
Add it all up.
That is exactly the point. And I think, that is, I think, where the more traditional healthcare system makes it so hard for patients to be therapy compliant. Because why should you spend 2 hours in a waiting room for a doctor?
Here's a great app. It's going to take you another hour a day to deal with.
And also, one anecdotally, I live in San Diego, so you would think a very kind of urban area, good infrastructure, but I have to wait 4 months for an endo appointment.
Wow.
And I'm a patient, not like a new patient, whatever, and I think if I have a question, I want to talk to an endo right away.
Yeah.
And that is what 9amHealth is delivering. So direct access to specialty level care and reduce frictions in your care journey.
That's fantastic. You're one of the more experienced founders in our Startup Health community, and we've got folks who are maybe having trouble seeing the light at the end of the tunnel, going through a tough year, and I wonder, given your experience, what's a piece of advice that you might give to a founder earlier in their journey that's struggling to sort of stay the course?
Yeah, I mean, it's, even for me as a second-time founder, it's not that, by far, we are struggling as well. So we have a lot of challenges, You might remember SVB crashed, we recently had a team meeting and we were reminded, oh my gosh, it's just a few months ago, that basically half of the startup world was bankrupt.
Yeah.
And I think it's important to always stay the course, really work hard. It sounds so simple, but don't get too nervous, stay the course, work hard, work through the problems. It's a very, very simple advice, but I think, that things can change really, really quickly. So what feels horrible today, can be a great day tomorrow. So that is
Good shift.
Yeah.
And that's what events like this can help, those sorts of moments happen, those inflection points can happen.
Yeah.
Well, Frank, thanks for taking the time with me. I know you're a busy guy. You guys are doing great work there, so thanks for giving me the update.
Thank you so much.
All right, thanks, Frank.